Hey, I'm Dr. Richard Amy. A lot of people know me as the Laser Doc. So, way back in 2002, I was working with lasers, and we had a plastic cosmetic surgeon down in Colombia that was using ultrasound and doing a lot of liposuction. So, whenever you're looking at fat and you're trying to remove fat from the body, it's really important that you really get through a lot of the scar tissue and help it to mobilize so you can pull it out. So, unfortunately, during the Christmas season, they ran out of ultrasound gel. So, his treatment was before I did the liposuction, the doctor would do ultrasound to break up the scar tissue and to help it easier. I don't know if you've ever seen liposuction. It doesn't look like the most pleasant thing to do. So he runs out of ultrasound gel. There's no way he can do the ultrasound prior to the treatment. He goes, hey, why don't we see if we take this laser, right, and we apply it topically about 6 inches away from the body prior to doing a liposuction surgery. And it was like, well, we don't know what's going to happen. Lo and behold, he was doing it for about 10 minutes total. That when he went into the liposuction, instead of really beating them up, right, and working himself out, it was like he was playing the violin. It was unbelievable, right? Couldn't figure out why it was working, but we knew it did work. And that's what happens, is that clinicians, we find things many times way before science catches up with us. So he's doing this for almost a year. He has a friend that works at the agriculture company, and then they have access to an electron microscope from the US. So what he did abdominal MRIs after he lasered, and then they did MRIs, serial of the abdomen, and then he looked underneath the electron microscope, and they could see that those fat cells, these adipose cells, look like beautiful grapes, would open up, create a transit channel, and the fat would dump out into the interstitium without damaging the fat cell. So when he was doing the liposuction, he had less bleeding, more fat, and easier on the patient and easier on him. That led to clinical trials that were published in both the plastic and reconstructive surgery journals and in the cosmetic journals as well. So some great articles. I know that I did in front of about 600 plastic cosmetic surgeons at the Ritz-Carlton in Detroit. I had a lecture in front of them. And so we had great research coming in. His English wasn't as good as mine. We were probably pretty close. And so I had a lecture. And so we're talking to these people beforehand, and they're telling us, like I've heard many other times, that they're going to laugh me off the stage. But we know, and the research is so good, that we know the laser, even applied externally, can help mobilize the fat. Now, if you're not doing liposuction, you have to do other things. You have to do nutrition. You have to do enzymes. I love the enzyme pheresis ice that helps break down different things. And then we have to move it through the body and the lymphatics. So here we go. What's the protocol for that? I like to use continuous, right? Continuous means I have just laser, no hertz, no pulsations for 7 minutes over an area that's about half the size of this book, right? So in one area, about 6 inches away, I like to do it for 7 minutes. They need to be on good nutrition. They need to be on enzymes. We're going to use the laser for 7 minutes. After 7 minutes, then I like to come back and use the lymphatic system, right? We need to move it through the body. So just because it mobilized, right, they're out, it looks like it's liquefied, but no heat, it's just energy. It's really cool. Then we have to get it through the body. So then we come back with the lymphatic system to push it through, and then we do a series of different things that you can do. You can do a vibration plate, you can do a percussive instrument, you can do whatever you want to do, but now you need to move it through, especially in that critical 30 to an hour. Now, we know during the research that if you don't get the fat out, it just gets reabsorbed by those cells because there's no damage to it. So it takes this thing, so it looks like it melts it, dumps it out, but after a while it reabsorbs it. So again, you have to move it. The protocol again is 7 minutes for about 6 by 6 area, maybe a little bit bigger than that. Then you do the lymphatic protocol, and then you move it out. Vibration plate, saunas, percussion instrument. Those are all the wonderful things that you do to help get the fat out. move some of those stubborn areas where you're having trouble losing fat, you're going to find that protocol works really well.